This, asked Dr. Durie, is another common question. Should a patient with myeloma have the antibody test for COVID-19? And the answer to this is probably not. The current antibody tests for COVID-19 are still unreliable, meaning that sometimes you can have a false positive or a false negative. And so this is not really helpful to guide decision making. However, it is quite important for antibody testing to be done in the study of a community. And so if there is an ongoing project within the town or city where you live, and there's a request to do the antibody testing to see how many individuals have been exposed to COVID-19, this is valid and actually very, very helpful. But the most important thing to be aware of is that the presence of the antibodies does not mean that you're immune to the COVID-19 infection. It just means that you have been exposed. And so this is extremely important to be alert to. So if you have a positive antibody test, this still does not mean that you're fully safe to re-mingle back in society, in the workplace, or even in the myeloma clinic if you go for a visit. And so very, very important to be aware of this aspect. Now, for individuals other than myeloma patients who may have been exposed to COVID-19, the antibody test is very important. And the reason for that is that individuals who have had COVID-19 infection and have developed antibodies, those individuals have what's called immune plasma or immune serum. And this plasma is very, very helpful, and trials are going on right now to see if this plasma can really be helpful to patients in their recovery process. And initial results with these plasma treatments have been quite encouraging, and so this type of antibody testing is important and useful. However, the routine testing for myeloma patients is not currently recommended.